Hi, so thank you for all the kind introductions, everyone. So today we'll be talking about kind of giving an overview about Taiwan's experience with keeping COVID-19 at bay, and also what IDA Healthcare Group has been doing. So as James said early on, we have a very close geography proximity to China, and it's around 160 kilometers. And because of that, our tourism, we actually get around 2.71 million visitors. That was listed in 2019. And for employment, we actually have around 404,000 people who work in China and around 800,000 who live there. So because of that, early predictions by Johns Hopkins University show that Taiwan would be one of the hardest hit countries due to COVID-19. And we do have a decent size population size, 23.8 million for our geographic distance. So the current situation now, we have up to date 438 cases. This is actually from yesterday. It's actually 439 today. We have had 6 deaths, 334 recovered. The excluded cases, so you can see here, tested cases are people who actually undergo the 2 tests. You have to get 2 negatives to be excluded. And for our cases, it's really important to emphasize that 55 of them were locally transmitted infections, and 347 came from imported infections. So this is really important because it shows that our community transmission is very low. And we've also added a 3rd category, 36 coming from the Dunmu fleet. The Dunmu fleet was one of the situations where one of our military naval ships actually had certain outbreaks. So they separated that because it wasn't coming into our community and imported infection rates. So our case fatality rate, at the moment, this is from April 18th. And so the global rate was at 6.5 and Taiwan was at 1.5. And the global cure rate was reaching around 24.5% globally. And in Taiwan, it was 39.4%. So this graph can show you kind of our cases. This is by number of cases, by onset, by week. So in the first week, from December 31st, we've recognized that there were some suspected atypical cases coming from Wuhan. And from that day forward, they actually started checking on airplanes to make sure if any of the passengers coming from Wuhan to Taiwan had any symptoms of fever or asymptomatic symptoms for pneumonia, fever, for COVID-19. And so we have 3 peaks that we can see here. The first peak came from certain imported cases from China. And then we can see a huge amount of increase here because we were having increases from USA and from Europe. And then the third would be from our Dunmu fleet cases. So again, the big emphasis here is that most of our cases are imported. So the geography distribution of cases. So the green parts, these are cases where there's actually 0 or 1 to 2 cases. You can see here that the red cases, the red districts, Taiwan has Taichung, Taoyuan, New Taipei City, Kaohsiung City. These cases have more higher numbers because that's where the geography distribution is the highest density. Oops, how do I go back? Sorry, give me 1 second. So this is a timeline that we've developed. This isn't every single policy that was established, but these are some of the key important highlights that we wanted to showcase. So this is from December, January, February, March, April, and May. So you can see here that in January, there was a lot more policies that were implemented, and that really recognizes that how Taiwan started early on to recognize the crisis. They had a very rapid response. They really focused on rapid mobilization, swift decision-making, thorough implementation, coordinated resource distribution, transparent information, and advanced technology. So as we said, December 31st is when they actually started checking on the flights from Wuhan. By January 2nd, they already assembled a task force. On January 15th, they've listed the case as a class 5 communicable disease. And at this point, it was still unclear whether person-to-person transmission, but they did list it as a high class to make sure that we have were all on high alert in Taiwan. On January 21st, the Wuhan travel advisory was changed to level 3. And the first confirmed case in Taiwan was actually diagnosed on this day. And then you can see one of the policies that were implemented was on February 2nd, there was actually school closure for 2 weeks. And then by February 6th, we had the mask quota system that began with the NHI cards, and this will be explained later in the presentation. On February 23rd, there was a travel ban for medical personnel. This is really important because it makes sure that the healthcare capacity and the workplace capacity is sufficient enough to tackle on COVID-19. And by March 19th, there was an entry ban for foreign travelers. And by March 24th, there was an airline transit ban, meaning that there's no layovers allowed. By April 1st, we actually implemented social distancing. And then you can see here, this is really interesting to see. By April 25th and May 1st, you can see some of the ease on restrictions. So the CECC Command Center that was established on January 20th. And the Commander-in-Chief is the Minister of Health and Welfare, Dr. Chen. And the Deputy Minister of the Interior, Deputy Commander Chen. So this is a very interesting collaboration because it's not just the health sector they're working with. The Minister of Interior is actually focused on policymaking, home affairs, security, population, land. So you can see here on how they separate the command center. It's actually a series of cross-sectoral collaborations. And that's the reason why we've been able to do what we've been able to do, is because we're not just thinking about the health sector, but we're working together with other industries to really make an effort to tackle COVID-19. So the role of the CECC is to lead the case investigation infection control. They're responsible for patient transport, medical facilities, coordination, expatriation, requisition, allocation of hospitals, hospital beds, and manpower. So these are some of the travel measures that were put in place. So what I was talking about before with level 1, 2, and 3. So level 1 is just kind of precautionary. You're just taking some measures and you're just watching out for what's going on. Level 2 is when you're kind of, you have to be a bit on high alert. But level 3, that's when we're really saying, okay, we don't want you to have any kind of travel unless it's very essential. So these measures began from Wuhan, and then it began to become global. So we started with measures with China, and then every day we were looking at the spread of cases. So Hong Kong, Macau, and then when we saw the spread to Iran, Italy, and then worldwide. And so that's why on March 19th, there was an entry restriction for foreign travelers. But why do we still have important cases? Is because we actually still allow overseas Taiwan citizens to return. And so that's why we're still getting cases that are imported. But what's really key is that we have health screening for passenger symptoms. So we triage at immigration and customs, separating the high risk from low risk early on. And by doing this, we're able to really single out the cases before they actually get into the community. And we'll talk about the process of the quarantine later on the slide as well. But they also have a partnership with the National Immigration Agency and the National Health Insurance Administration. And that's how we've been able to also keep track of their quarantine measures. So the National Health Insurance is also something to understand about Taiwan. It was actually introduced in 1995. They had compulsory social health insurance program for all citizens from birth. So it's essentially universal coverage. So each person at birth, or if you have a foreigner and you're in Taiwan with a resident permit for over 6 months, you can apply for your health insurance card. And it's really cool because it's 99.9% coverage rate. And this chip here is actually linked to your health administration information, your personal information, your insurance, how it calculates the rates, and your medical data. So all you have to do is when you go to a hospital, a clinic, you just bring this card and they have all access to your data. And it's really great because the satisfaction rate in 2018 was 86.5%, which shows that there's a lot of faith in the system and it's working. So this is really key because in the COVID-19 response, what I said before is that they linked it with the National Immigration Agency and the Ministry of Welfare to check for specific region travel, high-risk occupation history, confirmed case contact history. So this little data can tell us at a hospital when we check it, whether this person had went out of the country. And it's also linked to our mask rationing supply chain. And we'll get to that in the next slide. So on January 24th, first of all, it's really important to be protecting the personal protective equipment supply chain. And we're gonna be focusing specifically on the masks, but we can tell from what's going on with our global countries and allies that personal protective equipment is one of the biggest situations that people are facing right now. So on January 24th, Taiwan suspended all mask exports, and they started early prevention to prevent stockpiling and price gouging. So you can see here that they currently give 9 pieces for 14 days for adults, and for children, it's 10 pieces for 14 days. So the national mask team that Tetra had discussed in the beginning was that there's 73 different manufacturers, and what they did was they worked together to quickly increase the daily output from 1.9 million masks in January, and to now in April, it was 16 million per day. And it's really important is that even though they're distributing this to the public through the name-based rationing system with the NHI card, they actually allow, the first thing is priority is to make sure that there's a reserve stockpile for each hospital. So it's 30 days worth of surgical mask and 25 days of N95, and that's always continuously stocked up. And even on April 9th, overseas Taiwan citizens can actually receive masks. And up to date, 17 million masks have been dedicated donations to our international allies. And we've seen a lot of innovation coming out because with the name-based rationing system, sometimes it was difficult to figure out which convenience store had the mask that you could buy. So they started creating apps, and even now we have online ordering. So we're gonna show you a quick video about how easy it is to buy the masks. So this is from the CECC. Basically, he enters, this is a convenience store, and all you do is you just click in through one of the ATM style machines. You put in your NHI card, and then you click on which mask you buy. You pay, and then that's basically it. You get your mask, and they track it because it's based on your NHI card. We can tell if it's every 2 weeks that when you're purchasing it, so you're not accidentally buying over the allocated amount. And what's interesting is if you didn't purchase your mask for the 14-day period that week, you can actually select to donate it to other countries. And up to date, Ministry of Foreign Affairs has said that we have donated 4 million masks from the public. So there are 3 different categories that Taiwan uses to calculate, to group the groups of risks, persons at risk for infection. So the first one is home quarantine. Home quarantine is people with travel history. Home isolation is people who had contact with confirmed cases. So that would be people who are in Taiwan who had contact. And self-management, this is more essentially if you've tested negative already and you've already been released from isolation, they still ask you to monitor your symptoms. So what they do is that we work really well with big data. Innovation is a huge thing in Taiwan. And so when you first leave for the country, you have to actually go through the quarantine system for entry. And it's just this QR code you scan, and they'll ask you details such as, where are you staying when you get to Taiwan? Do you know that you have to be here for 14 days quarantine, and you have to declare your health? So it's really interesting this way because everything is online, and that actually increases the efficiency and accuracy of surveillance. So after they do the entry point, and the close contacts with confirmed cases as well, they go through the epidemic prevention tracking system. So this system is separated with, again, the home quarantine and the home isolation. And the only reason it's separated is because there's different authorities that are monitoring their symptoms and checking in. So for home quarantines, those are people, again, who came in from imported cases, travelers. They're being monitored by the civil officers, and home isolation is being monitored by the health officers. And so how do we make sure that they're staying in quarantine is through the electronic security monitoring system. And that actually works aligned with a digital fencing system, which protects your mobile phone. So they track your location and health status through quarantine or isolation through mobile phone tracking. but it's not using a GPS. So what happens is when you leave your designated quarantine area, the police will actually get an alert, and they'll usually respond around 15 minutes, so it's rather quick. It essentially triangulates the mobile phone and the cell reception. So we know that it's not 100% accurate due to the GPS technologies, but it is more favorable because it's less intrusive and to personal privacy. So people are a lot happier with that. And also with the epidemic prevention tracking system, there's a LineBot system. Line is kind of like WhatsApp. It's kind of a device that's used here to communicate with people. And people just actively report their health status every day and get support when they need it. So each local government, they have a care program. And through this care program, they check in with mental health. They check in if you need to get food, if you need to throw out your garbage. It makes quarantine a lot easier. And there's also economic subsidies of 1,000 NTD per day for the 14 days that you're quarantined. So what's really key is that Taiwan really focuses on centralized communication as well. As I said before, they really emphasize on cross-sectoral partnerships. So it's coordinated communication through all the sectors. And from the healthcare perspective, actually hospitals are not allowed to disclose if they had any confirmed cases without authorization. This is actually to prevent panic. And through the media, every single day, we've had a press conference from the CECC around 2 p.m. This is actually a drawing from one of the members in the public because it shows exactly how trusting and how happy people are with our CECC. People are very satisfied with the response because they're very transparent and they provide the information rapidly. And you know, everyone in Taiwan, the government's really making an effort. They're online, Facebook, Twitter, they go YouTube, there's commercials on TV, really focused on epidemic prevention measures and communicating with the public. And so to communicate with the public, we know that there's an infodemic right now. People have low health literacy rates. So they're very focused on providing multiple languages because in Taiwan, it's not just the Taiwan culture we need to think about. There's also lots of different foreigners that live here. And there's a huge focus on transparency. And they really want to emphasize to the public that we're working together and not against each other. So there's a very humanistic and honesty, empathetic approach being used. So this is really interesting. So this is actually, I don't know if you can see, but they're actually all wearing pink. And the purpose for that is because sometimes the masks, they have different colors and they really wanted to break the gender stereotypes that boys can wear pink too. And they also use humor over rumor to disseminate communication messages. So this is from the executive yuan. So there was a lot of public anxiety about shortages such as toilet paper or food. And they were kind of using the proverb, we only have one ass, so you can buy as much as you can because it actually only improves consumption. And so through the hospitals and laboratory networks for Taiwan, there's 163 designated testing centers, and they get triage through response, isolation, or regional hospitals. And the triage is done by our CECC. And so you can see that the hospitals and laboratories, they are spread out throughout the country. So it makes sure that every region, we have a designated area to go to if needed. And Taiwan has really learned early lessons from SARS back in 2003. From the Taipei Municipal Heping Hospital case study, there was 150 acquired infections with 35 deaths, including 7 healthcare staff. And so because of this, they really revamped their Communicable Disease Control Act. So they focused on allowing regulations for gatherings, they specified penalties and fines, and they make sure that hospitals are prepared. They really focused on everyone making sure that they have epidemic prevention and control measures, and they always conduct yearly audits, and it's a requirement for accreditation. So I think that's really, really key to show because it emphasizes that the health system's capacity is able to respond and allow Taiwan to respond quickly. So IDA Healthcare's group experience with COVID-19. This is actually what our hospital looks like. So IDA Healthcare Group is actually split into 3 different hospitals. So it's split into IDA Hospital, IDA Cancer Hospital, IDA Dachang Hospital. And we do have quite quite a bit of staff as well, and we're really focused on protecting our healthcare workplace capacity here. And as mentioned early on, we are very happy to say that we have JCT and JCI accreditation. And to emphasize, actually, Dachang Hospital is the only one classified as a response hospital. So this means that we'll get the cases for COVID-19 when the CECC designates it. And the NPI beds are a number of negative pressure isolation wards that we have. So at Dachang, they also very rapidly activated the hospital emergency response system. Every single day, Vice Superintendent Dr. Chen Ling, he's a commissioner for this response team, and he has holds a meeting every single day. And so they work cohesively with the CEC's hospital recommendations to prevent hospital-acquired infections. And what we've done so far is we've also rerouted public entry to the 2 main entrances. So by rerouting public entry, you can really prevent patients coming or members of the public coming in from various entrances. We're able to just navigate things a lot better and check their triage and their TOCCs early on. The patient triage was also determined early on. So if we had a confirmed case, they would be placed in a negative pressure isolation room. If we had a case with pneumonia and highly suspected with COVID-19, they would be placed in a quarantine ward. So we have various measures in place to make sure that we protect and make sure that we have rooms for each of these cases. And we've also dispersed the staff workplace. So this is really important. So the style of the workplace setting in Taiwan is that you're really close proximity with your colleagues. What they've done is that they've actually made sure that you're not sitting next to side by side with one of your staff colleagues, because if there was a cluster of hospital-acquired infections, this will actually reduce the number of hospital workforce that would have to go under quarantine. So when you enter the hospital, you have to go through 4 steps. So the first step is to wear a mask. The second step is to use hand sanitizer. The third step is to check your TOCC and get stamped. And I'll go through that in the next slide, what the TOCC is. The fourth step is you're gonna get your body temperature checked. And the body temperature, if it's over 36.5 degrees Celsius, then that's considered a fever, and we'll go through more rigorous checks on that. And you can enter the hospital if everything is clear. So the TOCC. The TOCC stands for Travel, Occupation, Contact, and Cluster. So this is how we check patients for any symptoms or any risks of having COVID-19. So with the NHI card that I had mentioned before, what we do is every person that comes into the hospital, we get their card, we put it into a machine, and if you have none of the high risk factors such as travel or occupation, then nothing will come up and you're good to go in, and you'll get 1 stamp. But if you actually left the country, so this is an example. So this is an example for someone who went to Hong Kong in the last 30 days. So they actually come up with an alert saying that this individual did not complete their 14 days quarantine yet, so they should not be on site at your hospital. They tell you you need to quickly call the local health bureau to make sure that this person is quarantined and not coming into contact with other individuals in the hospital. And if you have a high-risk occupation, this would be considered medical personnel or something like airline individuals. They would actually show up. And this is really important because high-risk occupations, obviously, if they have any of the symptoms, that we want to be monitoring this. And so if you get if you get 2 stamps coming in, it's because if you traveled out of the country under 14 days, you're obviously not going to be allowed into the hospital. But if you were between 14 days to 30 days, you're allowed in the hospital if you have no symptoms, and you'll get 2 stamps. And so some of the other implementation measures that Taiwan at Dachang has done is that we've restricted at the food court, it's restricted to takeaway food or 1 person per table. And then in the waiting rooms, we've actually asked patients and members of the public to not sit in the middle seat to make sure that we can practice social distancing as best as we can. When you're picking up stuff like your medicine or having to go to a counter to talk to someone. There's actually plexiglass shields to prevent the spread of airborne germs. And then in the pharmacy and convenience stores that we have in the hospital, there are social distancing labels to make sure everyone's following the 1.5 meters rule. We have an increased frequency and replenish for hand sanitizer. And our outdoor area, this is the outdoor area. So if you had 2 stamps and you have fever, we're not gonna treat you, but we're actually gonna send you to our emergency outdoor tent. And this prevents having an infection inside. We can just check your symptoms outside. And meetings, like we're doing now, has been shifted to conference calls, online meetings to prevent mass gatherings. So the impact to Taiwan's health sector, COVID-19, even though we're somewhat in a more normalized way, there is still an impact because typically in Taiwan, they like to go hospital shopping here. So it means that they like to try out various hospitals. And so there's always a lot of hospital visits. But because of COVID-19, there is still anxiety and fear in the public to come into the hospital. So people are still avoiding certain health services. So we did see a decrease in hospitalization rates and number of ER and outpatient visits. So you can see here from 2019 to 2020, the change here is actually a decrease of 14% for hospitalization rates, 17% for outpatient, and 15% in emergency room. So the revenue has also gone down from this. And at Shinkong U Hosu Memorial Hospital, their revenue went down by $6.7 million. So I guess overall, we really want to just summarize that Taiwan has been doing well because of the rapid response. They really focus on transparent information, health literate education, communication with the public. And what we're doing now is international collaboration. We really want to figure out how to strike a balance between epidemic prevention and control, and the economic activities is a global critical issue that we think is important to emphasize. And I hope you guys have time in your own to see, if you wanted to just see what kind of daily life in the semi-normal life in Taiwan would be, this is a video that we recommend watching because it's actually very engaging and it kind of shows more from the public perspective about what is actually happening here. That's all for my presentation. Thank you very much.